So hello, my name is Paul Burnette. I am the co-founder, one of the co-founders of Align Clinic, along with Steve Baum and Grant Wood. I've been an orthotist since 1980. I've been working with patients in both prosthetics and orthotics, and when I started with Grant Wood with Align Clinic, started focusing mostly on scoliosis. And I still remember when I met Grant, I was doing mostly the Boston brace. And when I first got acquainted with the Chanel-Rigo with Grant, when I first saw the orthosis and saw the mold, I wasn't sure what I was seeing. It looked so different than how I was trained and how it looked. And I didn't know what results that kind of brace could get. And when I first saw it, when I worked with Grant in an earlier company, I was quite amazed at the results, both of clinically how the patient looked and presented, and also from the result from the x-ray itself, and a two-dimension x-ray of the cob. And it made me realize it was kind of almost mind-blowing in a way what different philosophy approach to scoliosis could be. So it's been quite the privilege to be working with someone with the caliber of Grant, and also, of course, Dr. Rigo. I was amazed about how much more knowledgeable Grant was about scoliosis. I thought it's like no one could actually know more until I met Dr. Rigo, and it's like, wow, Dr. Rigo is amazing. He knows this much more than Grant, and coming to SoSort here, learning about how much that I don't know. It's just kind of, it's humbling in a way. So I've seen firsthand with my own patients what the WCR can do as far as improving both the scoliosis, the clinical presentation of the patients that I work with, as well as the correction in the x-ray. I've learned that there's more than one way to skin a cat, so to speak. I've been thankful for, like, the internet, the parents and patients doing their own research, and the fact that Align Clinic shows up on some of the very top of the list of searches. The fact that is a company that I helped create, and the parents entrust us enough with their kids to come see us. And again, seeing the results of that of the brace itself, how it functions, has been fantastic. Have been lucky to surround myself with people that are very knowledgeable in scoliosis. People from all over the world. In fact, one of the new people that we had come on staff, Raul from Spain, working also with Dr. Rigo, has helped us refine, the brace itself. Again, the results of what we do kind of basically speak for itself. So basically, for me, I've been doing this career since 1980. I've just had a remarkable life in a way. I've been lucky enough to be at the right place at the right time. It started back in 1980 when I got into this career. Had the privilege to be able to work with patients, to work with parents, I think hopefully to improve people's lives, not only in scoliosis, but also prosthetics, artificial limbs, the cranial remolding helmets. It's been quite amazing. I feel just extremely lucky. I started working with Grant probably over a decade ago. Grant Wood, one of the co-founders of Align Clinic, and the W and the WCR, the Wood and the WCR. Also with Steve Baum, who's a great pediatric orthotist. Worked with him for well over 12 years, was the best man in his wedding. With Anthony New, who I consider the big brain in the business. I think both with Grant and Anthony, a little bit with Steve, I think the less hair, the bigger the brain. So me with most of the hair, maybe the smaller brain. But it's been great. I think that few of us realize that that we get a great deal more than we give. So the things in my career that I have given, the things I have gotten back are just huge. It's gratitude. I have gratitude to be able to be in this profession. I have gratitude to be working with the people that I do at Align Clinic. I have gratitude to help create a company from nothing, a company that's now pretty much renowned in the world of scoliosis. When you do an internet search on scoliosis, one of the first people that pops up is Grant Wood. Dr. Rigo pops up, who was instrumental in helping us at first. So it's just been an honor. I have gratitude for all the people at Align Clinic that I work with, from the people in the front to the people in the back. I'm in this unique world in a way because I get to do direct patient care on one end, and then there's another end where I'm one of the people that help produce the WCR, help with the design. I'm the person that first starts the process on the computer. After a scan, I do the CAD process. And so I'm able to go back in the lab and get a little bit dirty and do the modifications that need to be done in order to help create the brace, along with Grant and Fee and Rahul, who also does the CAD. I get to take that product or that thing, take it into to a room with the patient and their parents, and make it part of them, to make it something that will change their lives, will change their posture, will change their presentation, and hopefully with scoliosis, stop the process of the curve progressing. So that's been just every part of that, of my career like that, has been like that. With prosthetics, I create a thing, and when it's up to the patient to make it a leg, I create a thing, they make it a leg. So it's to be able to be on both sides of that equation kind of makes me feel like I'm part of a whole. So if this is part of the video, I'd like to thank everybody at Align Clinic that has helped me be a better person, and that it helps me in the process of helping improve the quality of life of the people that we see. So thanks. So for me, one of the most important things I think I learned about scoliosis over the years, particularly after I met Grant and we started making the Chanel Rigo, the WCR, because when I first started, all we would see, or all I would see, is an x-ray, and it would be a certain degree. It's like, well, this is a 25-degree curve, and I've got to take this symmetrical brace and push on that curve and try to make that curve 50% better, because that's what's important. You've got to try to get as straight as possible. And it wasn't until I started learning about the Rigo Chanel brace and the philosophy of that type of approach that it's not about the Cobb angle so much. It's about the three dimensions of the spine. The spine is just not a vertebrae on top of a vertebrae and going over in this direction and getting this Cobb angle. It's a matter of rotation that's going on at the same time. And the type of brace that I grew up in my profession making was a symmetrical brace that just mostly dealt with that Cobb angle. And it wasn't until the Chanel Rigo approach that I learned that it's all about kind of de-rotating that spine, elongating that spine, and getting a better clinical presentation. And I think that's important to realize, that you can go to some companies and they'll say, oh, well, we'll get, if your daughter has or son has a 30-degree curve, we'll get it down to 15 degrees. That's part of our philosophy and guarantee. We don't look at it that way. We look at the person first. So if you're bringing your daughter or son in, the first thing we do is that we look at your son or your daughter. how do they present? What is the scoliosis? What changes are they making to their body? Helps us start thinking about the process of what can we design, what type of an orthosis can we design to help correct this, the scoliosis. Then we look at the x-ray and we say, oh, okay, that makes sense. This x-ray matches up what we're seeing clinically. And if it doesn't, we put our heads together and we say, okay, something's a little bit different going on. So we need to kind of change the way that we design the brace as compared to maybe if an x-ray matched up with exactly what we saw. So everybody that comes to Align Clinic or sees anybody that's been WCR certified, Wood Chanel Rigo certified, goes through this training, has the help of other clinicians within the company, within our family, to call them, go, I've got something unusual here. Can you help me out? How would you classify this person? And what can you produce or make for me that I can put on this patient to correct this scoliosis or help reduce the scoliosis? So it's an entirely different approach than what I was trained. One of the main things is knowing that when you come to either in San Mateo, to Align Clinic in San Mateo, or see Emory in Wisconsin, or the people right now I'm training in North Carolina, Amira of Ability, all these people that are WCR or either in training or already certified have a huge amount of knowledge and experience, and are able to call on each other to be able to, I think, provide the best possible care that you can get for your daughter or son. One interesting thing when I try to put the math together as far as Align Clinic goes, and the fact that you just don't get Paul Burnette, you just don't get Grant Wood, you just don't get Emory, you get all of us. You don't get, I have, oh man, I'm gonna show my age now. I've been doing this since 1980. I'm applying for Medicare this year, but so I've got 38 years, 39 years of experience, but at Align Clinic, it's not Paul Burnette and 39 years of experience, or Grant Wood. I think he started when he was 2 years old, because he's got like 35, and I mean, he's a child, so I don't know. He must have started when he was 2, but you get my experience plus his experience plus the years of experience that Emory's had plus the years of experience that Raul's had plus the knowledge that Dr. Rigo has instilled and Dr. Chanot with Grant. So probably the combination of when you come to Align Clinic, you're getting, I don't know, 500 years of experience between all the family of Align Clinic. So I'm very proud about that, and I think that's something that when people do come to any WCR certified orthotist or clinic, that's what you get. You get an accumulative amount of experience all in one.